TikTok is diagnosing millions of people every day. But here's what almost everyone misses when it comes to diagnosing a medical condition. By the end of this video, you'll understand why these TikTok diagnoses sound accurate, why many of them are not, and how medicine actually determines whether something is a real diagnosis or not. I'm a registered nurse, and I hear these diagnoses from patients constantly, not because people are foolish or anything like that, but because online health content skips how diagnosis actually works. So let's talk about myth number 1. ADHD is a symptom list. TikTok claim. If you struggle with focus, motivation, or procrastination, you probably have ADHD. But why does this myth spread? Well, it's because focus problems are common, stress worsens with attention, and symptom lists are broad enough to fit almost anyone. But what's the medical reality here? ADHD is not a diagnosis by symptom overlap alone. Clinicians require generally symptoms present since childhood, impairment across multiple settings, and it's usually something that's long-term and has consistent patterns. Difficulty focusing alone does not equal ADHD. Myth busted. A common symptom does not equal a neurodevelopmental disorder. And this same mistake shows up in almost every viral diagnosis. Myth number 2 is stress equals high cortisol disorder. TikTok claim? Your stress means your cortisol is ruining your body. Why does this myth spread? Well, it's because cortisol is real. Stress causes physical symptoms, and hormone explanations can feel scientific. But what's the medical reality? Well, yes, cortisol rises and falls naturally. It changes throughout the day, and it increases during stress. And it does increase during stress without being a disorder. There is actually no recognized diagnosis called adrenal fatigue. Adrenal disorders are rare and usually involve things like specific lab abnormalities, medication side effects like steroids, or serious underlying disease related to organ dysfunction. Myth busted. Stress symptoms do not equal a hormone disorder. Myth number 3. Relating to traits equals an autism diagnosis. TikTok claim? If you relate to these traits, you're autistic. Why does this myth spread? Well, it's because autism traits overlap with normal personality differences, and adult self-reflection feels validating. But what's the medical reality? Autism diagnosis requires a detailed developmental history, early childhood patterns, and functional impact over time. Assessments are extensive and clinical, so relating to traits does not equal a diagnosis. Myth busted. Recognition is not the same as clinical assessment. Myth cluster number 4. POTS, EDS, MCAS, leaky gut. TikTok claim. If you have dizziness, if you have joint pain, if you have GI symptoms, flushing, or fatigue, it's probably one of these. Why is this myth so powerful? Well, because symptoms are real, tests are often normal, and people feel dismissed when they go to the doctor. But what's the medical reality check? A POTS diagnosis requires documented, consistent heart rate changes with posture, not just occasional dizziness upon standing up. Ehlers-Danlos is not diagnosed by hypermobility alone. It requires specific, detailed criteria and often a genetic evaluation. MCAS involves recurrent, multi-system reactions, not just an isolated few episodes of itching or hives. And leaky gut is actually not even a medical diagnosis. Increased intestinal permeability can occur in certain diseases, yes, but it is not a standalone condition. Myth busted, symptom overlap does not equal diagnosis. Myth number 5, normal tests means the doctor missed something. TikTok claim, if doctors can't find it, they're missing something. Why this feels true? Because uncertainty is frightening. But what's the medical reality? Medicine works by ruling out dangerous causes, narrowing possibilities, and managing risk. Normal tests often mean serious disease has been excluded, not ignored. Myth busted, normal results are informational, not a failure. And before you self-diagnose, doctors always look at a few basic things first. Just so you know, this doesn't mean you're being dismissed. Sleep quality and duration, caffeine and stimulant intake, alcohol use, nicotine or vaping, diet and under or overeating, stress and nervous system load, medications, and supplements. Sometimes these alone can cause dizziness, fatigue, GI issues, anxiety, palpitations, and brain fog. So ruling out common causes comes before assuming there is a rare diagnosis. The danger isn't curiosity about your health, it's mistaking symptom overlap for medical diagnosis. So what should you do if something concerns you? You should track patterns, note triggers and duration, bring observations, not diagnoses, to your provider. That's how real diagnosis happens. In the next video, I'll explain why anxiety can mimic serious illness and how doctors tell the difference.